General Place, thanks so much for that update. So we've got a lot of questions. They're streaming in. So I want to get to a couple of them. Probably the most important one is when does DoD anticipate having the vaccine widely available to military family members and the broader military connected community?
Sure, that's a great question. So we're looking at in a tiered responsibility, similar to what we've seen from the CDC. We have those tiers, and that goes for service members, family members, retirees, et cetera. And as a reminder, all of our beneficiaries can be vaccinated inside our system or in the civilian healthcare system. But going back to that tiered approach, we have 1 Alpha, which is largely the healthcare practitioners, first responders, police, firefighters, et cetera. 1 Bravo and 1 Charlie, those are over 75-year-olds, critical national defense. 1 Bravo, 1 Charlie, over the age of 65, but not 75, under the age of 65 with significant medical problems, those sorts of things. 1 Bravo, 1 Charlie, that's where we are in most of our locations. Tier 2, the general population without significant medical conditions, that's the largest population. As I mentioned, most of our locations are in 1 Bravo, 1 Charlie. So therefore, we are currently focused on critical national security and the medically at-risk population. Now, for each individual person at each individual location is probably going to vary a little bit. In fact, some of our locations are in tier 2 right now. Not very many, but some of them are. I see a significant number of our locations moving into that tier 2. The general population are young, healthy, everyone sometime in April. So still working through those issues right now, but in the relatively near future, open to everyone. Finally, when your community begins distributing the vaccine to your population group, you can receive it free of charge anywhere that provides immunizations. Again, inside of our system or out in the network, out in the community, in pharmacies, community mass vaccination locations, civilian hospitals, civilian clinics, civilian private practices, anywhere. Just make sure that you bring back the information so that we can put it in your electronic health record and then help you manage that over time.
That EHR is so important, the electronic health record, and thanks for sharing that information. I'm sure everybody is exceedingly happy to know about the potential opportunities coming down the road. We're really interested, another question's coming in about, has DoD determined the priorities for families who are PCSing soon or those who are deploying it, in transit?
Sure, that's a great question. There's 2 parts to the answer. The first is for service members deploying. We provide the vaccine with enough time for all of our service members to receive both doses before they deploy. It's happening now, it's working well. We haven't had a single unit or a single organization where that's been a challenge. For families, it's important to know that we're shipping the vaccine everywhere in the United States and overseas. So when your tier comes up, no matter where you are in the United States, OCONUS, coming from OCONUS to the United States, when your tier comes up, you get the vaccine. And in our system, while in many locations, it's just one version of the vaccine now, as supply becomes more and more and more, all of our locations will have, at least for now, what we have the majority of, Pfizer and Moderna. And as the Johnson & Johnson Janssen vaccine becomes more available, locations will have that as well. So people don't need to worry about it. No matter where they are, we'll get them the vaccine.
I got it. And that really does answer the question about supply chain for service members. That was another question that we had. And it sounds like everything's on schedule. That's super reassuring. So I want to talk now about vaccine hesitancy. So, there's hesitancy among the military population. There's a recent study, in particular with communities like mine, people of color, with such a large portion of the military represented from ethnically and racially diverse communities. It's a big question. I'm really interested in knowing, what is the Department of Defense doing to help ease this anxiety and to encourage vaccination in communities of color?
Sure. I mentioned in my opening comments, and I'll give you just a bit more details to it here. We're monitoring the uptake amongst everyone, our service members, our family members, retirees, retiree family members, as well as our civilians and employees. We're across all of it. I was in Hawaii last week and saw our operations and the opportunity to speak to some of our service members of all backgrounds, all demographics. Some service members said they wanted to wait because they thought others were at greater risk than themselves. In terms of the declination rates, whether it's people of color or not, it's not just what I have to say, but it's really what those who are around everyone has to say. So family members, friends, their first sergeant, their squad leaders, their roommates in the barracks, people that they interact with on post. In general, people are getting their information from their local sources. So here's my answer to that. The safety record of the approved vaccines are exceptional. As Dr. Fauci mentioned just a few minutes ago, over 80 million doses have already been administered in this country with very low numbers of adverse events, anaphylactic shock, some other side effects, but very low numbers of actual events and even fewer hospitalizations and no known deaths from the vaccine. So I just said it, 80 million doses administered and no deaths. What if there was 80 million cases of COVID and no vaccinations? Well, right now we're seeing a case fatality rate in the United States of 1.8 from COVID, meaning of those 80 million doses would be 1.440000 deaths. That's right, almost 1.5 million deaths. That's just the math behind the science. So I get hesitancy. You heard him talk about the long-term effects of that sort of thing. But the fact of the matter is the infection itself, COVID itself, is horrifically more dangerous than vaccination. And it's irrespective of all demographics. And that's my answer to everyone, people of color or anyone else.
That's exceedingly convincing argument, and I haven't heard it quite articulated that way. But you know, it is about safety at the end of the day, and there haven't been any reported deaths from all the vaccinations. And so you're right. It's about influencers too, making sure that family members. You know, I talk to my family and try to communicate to them how safe the vaccine is as well. But that does matter as well. Another question that came across is a third of our military family members are moving every year. And one of the challenges with moving is not really necessarily knowing what kinds of precautions they should take as they prepare for the moves in the coming months. Do you have some advice for those family members?
Sure. I like going after Dr. Fauci because a lot of what I can say, I'm repeating what he said, and I think that's a pretty good place to be. I think we're on a good path to defeating the virus, and it's going to take a number of actions, whether we're PCSing or not PCSing. But the most important thing is to protect yourself. So just like on the aircraft, they tell you, you know, if we depressurize, put your own mask on first, and then help your kids. First thing, protect yourself. Get vaccinated. And then second, encourage your family, your friends, everybody else to get vaccinated, because as we move across the country, that's going to be key to it. And if we want things to get back to normal, if we want to be able to, as we PCS, to check in with our grandparents, when we want to see friends along the way, it will be much better if we're vaccinated. You got the teaser from him as well. Pretty soon we're going to have more information about what that means. So that's the first thing. Second, while we're waiting our turn as we prepare to PCS, do all the things that your mom told you to do when you were a kid, right? Stay home when you're sick. Wash your hands. Wear your appropriate face coverings. Physical distancing where it's appropriate. All those things. I mean, we've been at this for a year now, but the end is in sight, and that's why we need to keep our guard up. So make good preparations, know who you're going to see along the way, keep yourself safe along the way, and get vaccinated when you can.
That's great advice. So many people want to make sure they're adhering to the safety protocols to keep their family members safe, and that's really good advice coming from somebody that has so much background experience like yourself. Last question, and this is an important one. A lot of our military and veteran caregivers and spouses have indicated that their service member eligible dependent is currently not considering the vaccine. Caregiving by itself is challenging and stressful, and it's just one more worry. Can you provide maybe a couple of words of advice or information that a caregiver can share to encourage their dependent that they're taking care of to receive the vaccine?
Sure, Kobe, thanks. That's a great question. I think the first thing we need to do is approach everyone with respect. So the first thing we need to do is listen. And I mean, listen to understand, not listen to respond. Some people may have an underlying condition that makes them wary of the unintended consequences that may come from a vaccine. That's normal, that's rational. And some are familiar with past injustices in our health system and withhold trust from that health system. I get that too. Some have heard of adverse effects after taking the vaccine and they want to avoid them. I get that. But we need to listen, and then we can help guide people. And a few things that seem to make a difference include these. First, No doubt in my mind that there's risks of COVID, both initial and long-term. But those risks of COVID far outweigh any risks that come with the vaccine, caregiver or the receiver. Sometimes I hear that individuals are fearful of unknown long-term effects. Again, you heard Dr. Fauci talking about that. I understand it, but again, just as much weight needs to be given to the long-term effects of the disease. Further, infectious diseases by definition involve all of us. And my taking the vaccine doesn't just help me, it helps the family members, it helps who I'm caring for, it helps who I live with. It helps everyone that I work alongside out of my office. It helps everyone that I go to the store around, even people I don't know at the commissary, grocery store, airport, wherever. Third, we're working through evidence from clinical trials to see what makes a difference here, what makes a difference in our communities in America, what makes a difference overseas. Now, we vaccinated the elderly in nursing homes first, and now we're watching hospitalization, deaths, new cases plummet along those population. In Israel, in fact, deaths, hospitalization cases are all dropping as they now have vaccinated over 50% of their population with 2 doses. So my advice to anybody who has caregivers, my advice to anyone who's concerned about vaccination, my advice to anyone really, it's all the same. The sooner we all get vaccinated, the sooner the pandemic ends.